something like this, Dr. Tsoukas, how serious is an aneurysm?
So if you were, say, 65 and you had a small aneurysm, life could be normal. You should be able to engage in most of activities. It'd be important to control risk factors such as cigarette smoking, diabetes, especially the very high blood pressure would have to be corrected. But one could continue living their usual, everyday life. Now, if an aneurysm was bigger, let's say over 5 centimeters, then the data show that once they cross that 5 centimeter mark, they become a little bit more prone to rupture.
Right.
Once they cross the 6 centimeter mark, they become significantly more prone to rupture. And from thereafter, the curve becomes exponential, as you see on the graph.
So just to reiterate, the size of the aneurysm will depend if it ruptures or not?
So yes, this is the main determinant. What will determine whether we are saying, okay, we can watch this. We have time. We'll control some risk factors.
Right.
Or we might say, well, we got to fix this within a month or two, because it's getting up there. Or we could say, gee, this is too big. It's 6.5 or 7 centimeters.
Right, we need to take care of this right away.
You need to come in right now.
Okay.
So the size would basically determine that.
Wow. Now, when should someone consider seeing a doctor? I mean, at this point, what I want to ask is the symptoms. Are you feeling symptoms if you have an aneurysm? And at what point are you seeing a doctor?
So hopefully and thankfully, most of us are seeing doctors every year, at least once a year. So most physicians will examine the patient's abdomen, with their hands. We call it an abdominal palpation. And once an experienced physician puts their hands on somebody's abdomen, they should be able to have an idea if someone has an aneurysm, a big aneurysm, and so forth. So the first line of detection, so to speak, would be that, the primary care's office, the primary care physician's office, where the patient will have a physical exam.
Right.
And the primary care physician would have an idea as to whether the aortic pulse feels a little bit more wide, a little bigger, which might lead to an imaging study.
Right.
From there, we would have a much better idea of what's going on.